the transmission-transmitted parasitic infections. So we will be talking about all the infections which can be transmitted through the blood. And today we only specifically talk about the parasitic infection. So the incidence of the blood transfusion transmitted parasitic infection is lower as that of the bacterial and the viral. So it can be transmitted through the blood transfusion. That's why we are discussing with the blood transfusion transmitted parasitic. So it must circulate in the bloodstream of the donor, comprises certain physical characteristics that can resist the processing steps, and it should be survive in the conservation to generate the infection in the blood receiver, such as like the parasite must retain its infectivity after the transmission. So what are the organisms? We will be discussing about the malaria, Babesia, Trypanosoma, Leishmania, Toxoplasma, and Microfilaria. So malaria, it accounts for the 85.2% cases from the Southeast Asia. If we talk about India, it is the third largest burden, and India carries 47% of the global Plasmodium malaria, making the country most important global malaria elimination. In that list it is coming. So we know the life cycles. So the Anopheles mosquito, the sexual stage in this mosquito, and the human is having the asexual stage. Modes of transmission. So asexual sporocyte of the parasites are injected into the human by the female Anopheles mosquito, and it can be transmitted through blood transfusion, organ transplantation, sharing of IV needles or drugs, or it can be transmitted by the accidental lab exposure. The first case of the transfusion transmitted malaria was seen in 1911, and the Bruce Chabot found that reported incidence of the transfusion transmitted malaria, which increased from 6 to 145 cases per year in the year 1911 to 1979. Then the Federica Vera et al. A systemic review of the transfusion transmitted malaria in the non-endemic area 2018. So 100 cases were reported in his report. So what is the transfusion significance? So asexual form of the malaria parasite present in the erythrocytes. So they are responsible for the transfusion transmitted malaria. So 10 ml 10 parasites per ml for P. vivax were enough for the transmission, as suggested by the Bruce Chabot et al. Transmission occurs not only by the whole blood or the PRBC, but it can also occur from the FFP, platelet, granulocyte concentrate, cryopreserved red cell matrix. So adenine present in the red cell preservatives like CPDA, SAGM, it will enhance the malaria parasite viability in the stored blood. Plasma fractionated product like albumin, IVIG, factor VIII, it do not transmit the parasite. If we talk about the storage of the blood, we all know that the storage of the blood occur at 4 to 6 degrees Celsius, and this plasma malaria is viable less than 5 days, and Plasmodium falciparum for the 10 days. The incubation period for the Plasmodium falciparum and Vivax is 1 week to 1 month, whereas for P. malariae it is several months. How we can diagnose it? It can be diagnosed by the rapid test. It can diagnose by the serology by using the ELISA. Microbial examination, we all know thick and the thin smears are most commonly used. And NAT test, which is the new generation test, which is more sensitive than the peripheral blood smear. So these tests can be used for the lab diagnosis. Next is about babesiosis. So it is endemic in the area of northern, eastern and the upper part of the Midwest USA. And the mode of transmission is exotic stick bite, organ tissue transplantation. It can also transmit via the transplacental route. In the blood components, it is survived for 35 days at a temperature of 4 degrees Celsius and remain frozen in the red cells for many years, and it is also transmitted by the platelet concentrate. 1 to 4 weeks after a tick bite, it's the incubation period, or 1 to 9 weeks after the transfusion associated infection. So how we can diagnose it? By the microscopic examination, immunofluorescence assay, and the real-time PCR. Most prevalent after malaria in the endemic part of the North America, and there is a permanent deferral of the individual with the history of babesiosis. In D.H. Persing et al. Reports, infection in the 4 patients in California was found out, and all the patients undergone the splenectomy, 3 because of the trauma and 1 because of the Hodgkin's disease. Next is Trypanosoma cruzi, which we all call as a Chagas disease. So the mode of transmission is triatomine or red bug feces, organ transplantation, transplant central route, and the breastfeeding. Feeding. Survival in the blood components, the whole blood and the PRBC. It can survive for 18 to 21 days. In platelets, the platelet lifetime is the 5 days, and in frozen plasma, less than 24 days. Incubation period overall, if we talk about, is like 20 to 40 days. And the lab testing is ELISA, immunofluorescence assay, chemiluminescence test, Western blot, and NAT. It's endemic in the Central South America and the parts of Mexico. Seroprevalence is 62% among 16 to 18 million person infected all overall. It's seropositive donor, there is a chance of 12 to 48%. In a study, Rezes et al., there have been 4 reported cases of the transfusion-transmitted Chagas disease, with 2 in US and 2 in Canada due to the Trypanosoma cruzi contaminated platelets, and the recipients were all immunocompromised. So after that, we'll talk about leishmaniasis. Leishmaniasis, it's caused by the sandfly, and its survival in PRBCs for like 25 days, in platelet 5 days, and the frozen red blood cells for 35 days. If we talk about the incubation period, it's like 2 weeks to 8 months, and the testing which will help to recognize this leishmania is microscopic examination, ELISA testing, immunofluorescent assay, Western blot, and the NAT. It's endemic in the eastern and the western Africa, Middle East, and the South America. And the transfusion by leishmaniasis is relatively very rare. In a report of Dodd et al. 2016, so 11 report of the transfusion transmitted leishmaniasis were seen, and of these 10 were the individual case reports. In one paper there from Brazil, 32 patients out of 82 received hemodialysis got infected with the Kala Azar, and one adult case of the transfusion transmitted leishmaniasis was reported in 30-year-old female from Haryana, India. Next is toxoplasmosis. So the mode of transmission by the cat by consumption of the oocyte contaminated water. So cat oocyte will be there, and that is contaminating the water, and after its consumption we can have this toxoplasmosis. So raw meat containing tissue cyst, transplant center route, organ transplantation. Survival in the blood component in the PRBC is for 42 days, and the incubation is 1 to 2 weeks. Lab testing can be done by the microscopic examination, ELISA, NAT, bioassay method, that is a gold standard method, immunosorbent agglutination assay, indirect fluorescent antibody test, and indirect hemagglutination test. The seroprevalence of the toxoplasmic gondii infection varies from less than 10% to more than 90% in different countries. Iran quotes the highest percentage, that is 62%. According to the Foratan et al. Study conducted from different countries, the overall rate of the toxoplasmosis infection seroprevalence in the blood donors was 33%, and the risk of T. gondii transmission through the blood transfusion, it's very low. So due to the ability of its survival and its replicate, it can cause the toxoplasmosis. So it had been suggested that the people who are increased risk of toxoplasmosis, such as the immunosuppressed individual or the pregnant women, they should be very careful for the transfusion of the blood as well as the components. So usually we in these population we used to give the leukoreduction components, and the deferral criteria is 6 months after the potential treatment and the complete recovery. Next is microfilariasis. Filariasis infection are usually caused by the vector, but if the blood from microfilariac individual is transfused, the transfused microfilia may persist in the recipient's circulation for more than 2 years. The transfusion acquired from the microfilaria is self-limited because transfused microfilaria do not develop into the adult filarial form. So in microfilaria infected blood recipient, allergic reaction might occur, but it's a self-limited. Now Palladium. So it's a thin-walled motile spiral gram-negative rod, and the mode of transmission is a sexual contact transfusion, percutaneous exposure perinatally. And the transfusion significance is like it can survive for 1 to 5 days at 4 degrees, and in platelets which are stored at 20 to 24 degrees Celsius. Incubation period is 4 weeks to 4.5 months with an average of 9 to weeks. So it can be diagnosed by using the dark field microscopy, direct fluorescence antibodies test, serological tests. There are some non-triposomal tests like VDRL, RPR to detect the total antibodies like IgM, IgG directed against the lipodial agent, and non-specific quantitative reported in the titers detect even after the few weeks of the infection. To diagnose reinfection and relapse, tripazonomal tests like FTA or TPAA, TPPA, TPHA, MHA, these can be used. So clear nowadays we are using. So presence or absence of the anti-treponemal antibodies in the specimen is determined by comparing the chemiluminescent signal in the reaction to cut off the signal determined from the active calibration. NAT like PCR, nested NAT, quantitative PCR, RT-PCR. Nowadays we are using these. Thank you.